Free CNA Exam 2026 Realistic Practice Test 40 Questions Answers. Question 1. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 2. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap, below the bladder to prevent backflow/infection. Question 3. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 4. When dressing a resident with weakness on one side, dress weak side first. Dress strong side first. Dress both at once. It doesn't matter. Dress weak, dull, undress strong. Question 5. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's, upright aids lung expansion. Question 6. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 7. The normal adult pulse rate is 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 50 to 90 bpm. 60 to 100 bpm is the normal range. Question 8. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 9. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 10. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 11. When a resident is on NPO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 12. A resident is in isolation. What is done with their linens? Double bag them. Wash in the sink. Throw them away. Shake them out. Double bagging or special handling per facility policy. Question 13. Postmortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 14. A resident refuses a bath. You should force them. Respect their refusal and report it. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 15. Which of these is a sign of skin breakdown? Redness that doesn't go away. Tan skin. Dry skin. Freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 16. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 17. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 18. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 19. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 20. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier.